Hello, everyone. It's Friday, November the 20th, and we've got a lot to go over with you, but we'll go over it with you fairly quickly, and then we'll surely go to our experts, and as well as our experts, then we'll go to the questions of the media, and I guess the first thing I got to lead off by telling everybody just this is every day that goes by, it seems like across, well, it doesn't seem like it is, across all of our nation and absolutely across West Virginia, we're not exempt here, this thing is getting worse. And I truly believe that it's going to get worse before it gets better. You know, a real cold snap may help in some ways, but at the same time, it will drive us indoors, and it will absolutely probably not help in a lot of ways. Thanksgiving is right around the corner. I surely hope and pray that, that you'll be safe in being with your loved ones and your families, and at the same time, you may very well be smart to do at least some of it on a virtual basis. Travel is going to be very, very, very difficult, concerning, and we need to watch what we do in regard to that. Today in the state of West Virginia, since Wednesday, we've lost an additional 27 people. It's unbelievable. You know, our 613th death is an 87-year-old female from Cabell County. Our 614th death is a 70-year-old male from Harrison County. Our 615th death, a 68-year-old male from Berkeley County. Our 616th death, a 75-year-old male from Ohio County. Our 617th death, a 74-year-old male from Marshall County. Our 618th death, an 82-year-old male from Kanawha County. Our 619th death, a 63-year-old female from Tyler County. Our 620th death, a 92-year-old female from Marshall County. Our 621st death, an 85-year-old male from Kanawha County. Our 622nd death, a 64-year-old male from Wood County. Our 623rd death, a 62-year-old male from Kanawha County. Our 624th death, an 83-year-old male from Marshall County. Our 625th death, a 70-year-old male from Logan County. Our 626th death, a 59-year-old female from Boone County. Our 627th death, a 74-year-old female from Lincoln County. Our 628th death, a 72-year-old male from Monroe County. Our 629th death, a 92-year-old female from Ohio County. Our 630th death, a 79-year-old male from Marion County. Our 631st death, an 85-year-old female from Mineral County. Our 632nd death, a 79-year-old male from Fayette County. Our 633rd death, a 68-year-old female from Summers County. Our 634th death, a 95-year-old female from Summers County. Our 635th death is a 74-year-old male from Pleasants County. Our 636th death is a 71-year-old male from Kanawha County. Our 637th death is a 77-year-old female from Kanawha County. Our 638th death, a 75-year-old male from Jackson County. And our 639th death, an 85-year-old male from Hampshire County. Oh, man. One thing that we have known since pretty much the beginning, our health experts tell us all the time give us medical knowledge that we're not trained in. And for God's sakes, if we don't listen to them, we're idiots. We have to listen to them. But they've told us all along that really and truly that this disease, unlike a lot of different viruses, some viruses attack the children, and some viruses attack all of us, and this virus surely does attack all of us. But at the same time, where are the primary targets of this virus? And they're the elderly. And we can see it again here today. We can see also that we've lost a 59-year-old lady. We lost a 68-year-old male, a 62-year-old male. It's just a 68-year-old female. I'm telling you, don't let these people just be a number. Please don't do that. Please keep them in your prayers. My gracious sakes of living, just think of the moms and the dads and the grandmas and the granddads and all that the wisdom that these people have given us. It's a shame. 639 deaths in the state of West Virginia right now. Okay, in the last 24 hours, we've had new positive cases of 1,081. We have had 6,806 new positive cases in the last 7 days. That means we're averaging right at 1,000 a day. Our daily positivity number is 4.77. Our cumulative number is at 3.42. Both are way too high for us in West Virginia because we've prided ourselves with being so much better than that, but at the same time, they're great numbers compared to what's going on all across this country. Our active cases are now at 12,177. Can you imagine doing the contact tracing on 12,177 people and how difficult that is? We have recovered cases of 25,664. We're down a little bit on our hospital or on our patients that are hospitalized. We're down a little bit on our ICU units. We're down to 402. I think we're at 433. We're down to 120 on the ICU. Yesterday in West Virginia, we tested 16,617 people. Our effective reproduction number is at 1.16. That hadn't changed much. That's probably right in the middle of the states in this country. By doing this, expansive testing, there's no question that we continue to discover, people that are asymptomatic and are able to help them in lots and lots of ways, especially from the standpoint of continuing to spread this disease without even knowing it. But West Virginia, we are absolutely trending in a very, very poor way at this point in time. We now have 6 red counties. Marshall, Mineral, Berkeley, Hardy, Wood, and Jackson County are all in the red. We have 14 orange counties: Hancock, Brooke, Ohio, Morgan, Jefferson, Hampshire, Barber, Wirt, Mason, Putnam, Cabell, Wayne, Boone, and Wyoming counties. From the standpoint of our nation yesterday reported another all-time record: 185,000 new COVID positive cases yesterday. Our COVID hospitalizations in our nation are also at an all-time high. we have now surpassed 250,000 people that have died in the United States. Like I said to you, the CDC announced just, that travel may increase your chance of getting and spreading COVID. Postponing travel and staying home is the best way to protect yourself and others this year. And that is a direct quote from the CDC as of yesterday. Another quote, celebrating virtually or with people that you live with is the safest choice this Thanksgiving. The Vaccine Advisory Task Force. News came out this morning that Pfizer will apply today with the Food and Drug Administration for emergency authorization of the COVID vaccine. Pfizer's reported that their vaccine has shown in excess of a 94% effectiveness in their trials. And once the FDA approves the emergency authorization, the vaccine will become distributed very quickly. Our Vaccine Advisory Council has been working on this since August. The National Guard's been heading this up and doing incredible work, General Hoyer and all of his people. And as soon as this vaccine is available, we will be absolutely distributing it in West Virginia, and we will distribute it under the guidelines of the CDC and the Food and Drug Administration. And with all that and everything, there will be certain people, the most vulnerable will probably be vaccinated first. But until that vaccine is in our hands, what is our best defense? What's our best defense? Our best defense is without question to wear your mask, keep social distance, absolutely do not go in crowded places and everything if you can stop it and everything, but absolutely our best defense to put this pandemic behind us is wearing your mask today. We've been through all the requirements in regard to the masks or the face coverings. There are printed signs available if your businesses need them, and they're right on our website right now. Our free testing map is also on our website and where we'll be and all that. I encourage all West Virginians to go get tested before Thanksgiving and before, spending time with loved ones. That's just going to make things better. All the free testing stuff is up again on the maps, and you see all that. And your drive-through pharmacy testing as well. The good thing about it is we have tested 91,000 West Virginians in the last 7 days. On Wednesday, we tested in excess of 17,000, an all-time high. And this is an incredible number, an incredible increase from a month ago. A month ago, remember, I was pleading with you to go get tested. And we just kept bebopping along at 3,000, 2,600, 2,900, 3,000. We didn't really take heed to what we should have done a month ago. Now at least we're doing it, but let me just tell you, and I want you to understand just this. Today we have a multitude of strategy, do we not? One of the biggest strategies that we have we have still today, is to go be tested. And by identifying the asymptomatic people, the people that could be very well spreaders, we are able to harness this disease. I'm really, really concerned. I'm really concerned. None of us wants, and I am the lead guy. Nobody wants to further restrict or shut something down. Nobody wants to do that, especially me. because of all the impacts, everything that can come with it. You know, we're hanging on as best we possibly can. We have set this whole system up to be able to do things on a county by county basis, to be able to go right to the hottest spots and try to do stuff within the hottest spots. I've told you over and over that everything's still got to be on the table. We're not moving towards shutting anything down in any place at this point in time, but absolutely, this thing is trending, and it is trending badly. We have got to absolutely do all within our power, and what is in your power today is this mask. That's what's in your power today. Now, soon we hope we'll start moving forward with the vaccine. You know, our kids need to be in school. We all know that. We all know that from the standpoint of our virtual learning, sure, it's better than nothing. But at the same time, we need to have eyes on our kids. We all know that the learning process is 1,000 times probably better than that of maybe a virtual learning process, and it surely may not be that, and I'm exaggerating that just to make my point, but we need to have eyes on our kids. We have special needs kids. We have kids that have every problem in the world, and we have parents that can't afford or don't know how in the world they could handle daycare and keep their jobs. We have so many issues that are right in front of our kids. Need to be in school, and absolutely, without any question, our schools and our numbers at our schools may be the safest place we can possibly be. Now, so as we go forward, though, we have got to recognize just one thing, and that is this. I am here to try to protect you. I want to protect your freedoms. I want to protect your safety. I want to protect your job. I want to protect the economies. I want to protect every bit of that, and I'll do that for all. You know, 1 week ago, I issued, as part of my executive orders, I issued an executive order requiring that the doctors, nurses, staff, and employees working at our nursing homes and assisted living facilities throughout the state of West Virginia be tested for COVID twice a week. Did I not? 1 week ago. Now get this. Today, I can report to you that since that order went into effect, we have found asymptomatic positive cases in 11 nursing homes or long-term care facilities. Now, I read to you what was happening at Stevens Correctional in McDowell County. How really a good man as a commissioner, you know, Cecil Patterson, called and said, "Governor, we got a real problem. We got a problem, Governor, and everything, and we got 12 or 14 or whatever it may be infected, and it looks like this could get really cranked up." And then when I reported the other day, on Wednesday, I believe, we had 260 inmates at that time infected and several staff. This thing can run through a nursing home and kill like nobody's business, and we know that. We have found since last Friday, 1 week ago, we have found 11 asymptomatic positives in our nursing homes since initiating that executive order. So it's good work by a lot of people there, especially our National Guard and our health departments. Great work. In our school outbreaks, we have 24. We have only 88 confirmed cases in our public schools. That's down. Like I said, really and truly, our public schools are absolutely the safest place maybe we can be. Our long-term care facilities now have 101 outbreaks. Our churches have 22 outbreaks in 17 counties. That's way up. That's Berkeley, Cabell, Fayette, Hardy, Jackson, Kanawha, Logan, Marion, Mingo, Monroe, Preston, Raleigh, Taylor, Tyler, Wayne, Wood, and Wyoming counties. You've heard it and heard it and heard it. A pew in between you. Wear your mask in church at all times. Absolutely in that building, wear your mask. And absolutely continue to social distance. And if you are especially an elderly person, you probably need to really rethink, should I go to church or should I get my services online or some other way? In our corrections, the situation is really improving at Stevens. Now, nearly 40 of the inmates have now recovered. We have 226 active inmate cases there. Stevens has 25 additional staff members that are tested positive there. 18 have now recovered. Throughout all the rest of the state, we have 10 active inmate cases and 34 staff. Now just get this one more time. We found, since last Friday, we found 11 people in nursing homes or assisted living by going there and testing twice a week. By that executive order, we found 11, I may have said 10, but we found 11 people in the nursing homes that were asymptomatic, that were right around all the patients and everybody, all the residents and everything, in 11 nursing homes. Now, just think about it. Think about this just a second. If I'm sitting here telling you that at Stevens Correctional Center, we now have 226 active inmate cases, and it's better. It's better than it was. If I'm telling you that, what do you think can happen in our nursing homes? We know what can happen. We've seen it and seen it and seen it. And so we got to really, really stay on our game. National Guard, great ideas and great work. The flu vaccine's still available. Please get your flu shot. The amount of dollars that have gone out to our cities and our counties is now $186,170,000 and change. And we continue to ask for people to continue to try to apply. The gun buck deer season is coming in on Monday. I did an interview this morning with a talk show, a hunting and fishing, I guess, talk show and everything. It was a real honor to be able to do it and everything because I'm a hunter and I have always enjoyed the buck deer season. I've always enjoyed bow hunting. I've followed my bird dogs wherever I go, and I hobble around a lot now, but I've walked across almost every mountain in this state, and nobody's been in the woods more than I, or on our streams more than I, and I love being there. I love the nature, the beauty of this state is unbelievable. Now, here's the thing you got to do. Abide by the laws. Wear your blaze orange. Absolutely use good gun safety. Absolutely be the safest that you can possibly be. Don't get out carousing around and drink too much and get on the highways. It's absolutely just going to be a chance for a disaster to happen. Absolutely, as you walk through the woods or whatever it may be, you come upon a fence. For crying out loud, don't lean your rifle up against the fence and then start climbing over the fence. Use good gun safety. Every year we have some level of tragedy just about happen in our buck gun season and everything. So we got to be super careful, and I want you to go and have a great safe hunt and enjoy yourself in this wonderful, wonderful state beyond belief. And it's a tradition over our Thanksgiving holidays that many people have loved, and I'm one of them. So go and enjoy and just be really, really safe. As far as our schedule next week, I want to tell you just this. We'll probably go a little later in the day on Monday and Wednesday. We'll probably go at 1 o'clock with our briefings on Monday and Wednesday. And we will not go on Friday. Most people are off and gone and everything. And but again, we ask if you'll just celebrate with your family. Take heed to all the travel restrictions, not restrictions, but take heed with all the travel advisories and just be really safe. You know, like I said, if we'll continue to stay together, West Virginia, really, we'll get to that vaccine and we'll get there soon. But that's all I've got for right now. Thank y'all.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. Today, I'm going to be very direct. I want to reemphasize some things the governor said. The United States and West Virginia are seeing more rapid spread of COVID-19 than we've seen at any other time during this pandemic. And as we look at West Virginia, we have 6 counties in red and I think 14 counties in orange. And remember, this is not the school map. This is not the sports map. This is a public health map. This is a public health alert map. So we are seeing rapid spread of COVID-19 in many parts of our state. And the only way for us to control that is to do what we have talked about every time that we get on the press briefing. Now, I think the governor has done an extraordinary job in keeping our state together and making sure we're pulling the rope in the same direction, make sure that we are responding to the fires. But at this point, as we have tested so much more, which has helped some, and as we have contact traced and tried to identify those people that are infected and separate them, we can see that that is not working sufficiently for us to be able to stop the spread of COVID-19. And in fact, the spread of COVID-19 is increasing in West Virginia. And we're seeing more people die on a weekly basis than we've seen before. In fact, we had the all-time high day of people dying this past week. We have set records as far as the number of people testing positive, and we're averaging now about 830 people a day over the last 7 days testing positive. And some of our counties have incidence rates or infection rates, as we would talk about from the Harvard Global Health Institute map, that are 100 per 100,000 or 90 plus per 100,000, which is way too high. So as we look at maintaining the safe place that we want to be in West Virginia, and we look at wanting to protect our vulnerable citizens, of which there's many, and trying to protect our vulnerable healthcare capacity, which so far we are doing, but also making sure that we have safe communities so that people who work in these healthcare settings don't get sick. It's time for us to do better work. And that better work is right now moving to all of us being committed to wear our masks. And when you wear a mask, wear it over your nose, wear it over your mouth. If you leave your nose uncovered, it doesn't really work. And the other thing is, make sure that you wear your mask indoors. Because what happens is, and I learned that people don't really understand this, that as you talk or sing or breathe even harder, like if you sing in a church, or if you breathe harder in a gym, or if you're yelling in some sort of crowded indoor space, then you are generating aerosols and droplets, and they continue to expand and they continue to grow and to stay distributed in the air even after you've stopped talking. And so when you have a crowded place, when you have a church in session, or where you're in a gym, or you're in a restaurant, or you're in a coffee shop, the more people that have their masks on, the more people that are talking or talking loudly or singing, the more you are continuing to grow the number of droplets and aerosols that are in the air and that they stay in the air. So the place can become much more likely to get others infected, even if you are physically distant. So when your mask is off and when you're indoors, whether it's over the Thanksgiving holiday or the holidays coming up, or as the weather gets colder, or if you're frequenting whatever business you are, and we certainly are all for staying open with our businesses as much as possible, but safely. But if masks are off, risk goes up. And so we really want to encourage everybody to pay attention to that, to stay safe, but also pay extra attention because COVID-19 is spreading significantly in West Virginia. And we're starting to see the impact of that, both on the color of our public alert map, but also on the number of people that are dying in our state and the number of people that are getting sick. I have a lot of faith in each West Virginia person, but it is time to step up, and we're not doing a good enough job at this point. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Dr. Amjad, our state health officer.
Good afternoon. I did want to add to what the governor was saying about the 11 nursing homes or assisted living facilities that we were able to find that did have asymptomatic staff that we did find with the executive order of testing. Those were good findings because we were hopefully able to catch future COVID-19 cases that could cause more infection in those facilities. And those were part of our initial strategy of our strike team forces that we are initiating throughout the state of West Virginia to address the nursing home outbreaks throughout the facility. So we do want to thank the governor for assisting us with those efforts. And with that, for example, we did initiate or engage those facilities with extra PPE, National Guard support if needed, all the things that we know do work with outbreaks in facilities. And hopefully that does cut down on our nursing home outbreaks throughout the state. Thank you.
All right, thank you, Dr. Amjad. Bill Crouch, Secretary of the West Virginia DHHR, is also joining us today and is available for questions. Major General Hoyer with the West Virginia National Guard had a prior engagement today, but he will join us again on Monday. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I have a question about what happens when you do have a church outbreak. Do you go to that church? Do you call the congregation somehow together virtually and say, hey, look, we got this going on. This is what we need to do. We need to test everybody. What do you do in those situations when you do have a church outbreak?
Dr. Amjad, this is you.
Hi, Paul. The health department does do their contact tracing. They call the contacts of the church. Sometimes they do have some difficulty with the contact tracing, and that this is a good time to remind everyone that they do need to answer the call for the contact tracers involved. We have engaged several of the faith leaders in the state actually for these types of conversations to encourage church members, if they can go online for services, to do that as well. But a lot of times the contact tracing is involved, and then also if they do need any types of services for cleaning in the church as well. But that is pretty much what we do, the contact tracing involved. If they need any help with mitigation efforts, if they need assistance with any recommendations inside the church for online services, PPE, we get a lot of questions from congregate members if they're doing the right things. A lot of them do ask us about temperature screenings, mask wearing. We get a lot of questions about singing in churches. While we do not recommend that singing goes on in churches, we've had questions if they are to do singing, what are some safety measures that they can do? We've gone through recommendations of that as well. But local health departments assist a lot when there's church outbreaks, Paul.
All right, thank you, Paul. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I have a question for you, and I'm going to preface it by saying I'm not emphasizing that sports are more important than getting into school or the health outcomes of any population in the state. It's just a question that was asked of me from someone in the Eastern Panhandle. We had a long conversation about it, and I thought I would bring it to you. I know that testing has been an emphasis of your strategy now for the past several weeks. You mentioned we tested 12,000 people, I think you said yesterday. The person in the Eastern Panhandle was concerned. They're involved with sporting teams. They're in the playoffs. They noted that this week, Kanawha County, over the first 3 days, had 13 free testing sites, while Berkeley County, which is the second largest county in the state, had 3, had only 1 yesterday, which had no previous publicity for the testing site. And the big concern is, can they get more emphasis on Berkeley County, the Eastern Panhandle? 3 of those teams right now are on hold for the playoffs because they have gone to red, and the chances of moving to orange are not very good if they don't have the opportunity to do large numbers of testing. I told him I would ask you that and get your response. Any chance you can move more resources to the Eastern Panhandle? Thank you.
Okay, Kenny, I do know that they, I mean, first of all, the superintendents, the superintendent in Berkeley County, the principals and stuff, we've been in contact with them a bunch. We sent additional resources there and everything to try to help them, but with all that, the testing sites are set up by the local health departments and everything. And, but absolutely, we're on it. We sent additional resources there. But I want to fall back and I want to just say just this. We have, and I forget exactly, 6 red counties and I don't know what, maybe 14 orange counties. 20 of our 55 counties in the orange and the red right now. I hate to say this because I'm a coach and I know how important it is and everything, especially to kids and parents and everything in regard to playing ball. We want to finish up the fall sports and everything. We're hanging on by a thread, finishing up the fall sports and not just canning the whole deal right now. From the standpoint of our sports, from the standpoint of the support and everything that we have already made in that commitment to Berkeley County, it is absolutely substantial already. And without any question, we have had dialogue, with the principals and the superintendents and congratulations to their state volleyball championship and on and on and on. We are trying with all in us, but the brass tacks facts of the whole thing are just one thing, and that is just this. Sports have got to take a back seat right now. They have to. First and foremost, we want our kids in school. Now, I want our kids to play without any opinion. I want our kids to be able to play too. But absolutely, I know how difficult this situation is and how absolutely this thing is spreading. And I know without question, at some point in time, we're going to have to realize that sports don't mean doodly right now. They don't. We've got to first and foremost get our kids in school, protect our businesses, protect our economies, protect every bit of that we can possibly protect. But at the end of the day, I'm trying, and I'm going to continue to try to be able to help those kids be able to finish out their seasons and absolutely finish out the playoffs, and then we'll decide what to do, with our winter sports. But we've already moved them, but let's try to finish what we got.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask a little bit more about the testing of our nursing home folks. About how many people is that we're testing twice a week now? Does testing those folks account for the recent spike in tests that we've seen? And is the results of that testing just included in their respective counties? Is it separated out in any way like we've seen? Thank you.
Dr. Amjad or Bill, if you could answer that, you guys got that information a lot better than I.
Yes, Governor, this is Bill. Thank you, Charles. It's a good question. There are somewhere between 12 and 13,000 individuals, employees in nursing homes, and then another 5,000 in assisted living. So we're really looking at 15 to 16,000 individuals we're testing. And And you are correct, that is part of the reason for the increased numbers you see. A lot of these are point of contact testing, which is antigen testing. We're still looking at how we report some of those antigen tests, as Dr. Amjad and Dr. March have talked about before. Some of those tests are cards, much like a pregnancy test. So you're looking at a result on a card that's not reportable unless it's reported and entered into the system. So not reported automatically or electronically. So we're still looking at how we can be totally transparent, provide all of that information in terms of testing. But some of those tests are PCR tests, which is our gold standard, and those are reported electronically. So you are seeing some of the increase there through the testing based upon the governor's order. We really are excited about trying to move this out to everybody as quickly as we can, and we are testing a lot of people right now. So again, it's been a huge success, and we appreciate the governor doing the order and backing the efforts here. So thank you, Charles. Good question.
All right, thank you, Charles. Next to Jade Burks with WVVA.
Hi, everybody. This is Jade Burks at WVVA. We're following up on that outbreak situation at Summers Nursing and Rehab. Is there any information that Dr. Amjad can share about the cases and deaths there? Or maybe Governor Justice, if you plan to deploy the National Guard to get involved at that facility? Also, I was wondering if you could repeat those numbers at Stevens Correctional. Thank you.
Dr. Amjad, maybe you can answer that.
Hi, Jay. At the Summers Nursing Home and Correction, let me look at my outbreak. I mean, we are following along there, our EPI team as well, but we have been checking in with them and checking with their PPE supplies and staff. And last time we checked in with them, they had the supplies that they need. Our other staff has visited there at least twice, and the National Guard has been there as well. And if you need the update on the Stevens Corrections, I wrote those down as well. They have 226 active inmates and 25 active staff, but we also check in with these facilities as well with our EPI teams. I don't have the active death numbers with the Summers nursing home right away. I'd have to look for the active numbers for that. But we can come back with you to those numbers.
I probably want to let me add one thing, Jordan. Okay, we need to emphasize that Stevens is operated by McDowell County. So the correctional center is operated there by the county, and it's the only facility in our state that's set up that way. But I just wanted to clean that up.
All right, thank you, Jade. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. I do want to follow up on the Stevens issue. Obviously, the inmates, the 260 now down to 225 approximately, are incarcerated and can't go out into the community and spread it. But what about those 28 employees that have tested positive? How much community tracing is going on there? Has there been a significant spread to the general population at large in McDowell County? And what's being done to address that?
Well, Mark, I know that corrections has gone in and is assisting. I know our guard has gone in to do sanitation work and everything. I don't have any the numbers here at this moment and everything, but maybe somebody else, Bill or somebody, maybe you could answer more about that than I. But I do know that. Our Department of Corrections has moved and our guard has moved to be able to assist and help. Bill?
I can.
Okay, Dr. Amjad. Okay, I'm sorry.
Well, from our Cub call this morning with General Hoyer, the guards did finish their sanitation mission yesterday. They stayed there all day for cleaning the facility, so we are aware of that. And we do know in McDowell County that we have seen an uptick in community members going in for testing. We have heard that from our contacts down there. So as far as community spread, we do know that the possibly contacts or family members, we're not sure, of course, but we have heard from our contacts down there that people are going in for testing. But the guards did complete sanitation missions down there. We heard that this morning on our briefing. I don't know if Bill has more to add or Secretary Crouch.
Yes, thank you, Dr. Amjad. Let me mention, first of all, that we have a COVID clinic at Welch Community Hospital. That is open 24 hours a day, 7 days a week. So anyone in McDowell County that's watching, please take advantage of that service that we have through Welch Community Hospital. And Mark, let me just say that those individuals that, and I believe there are 33 now, staff individuals who are positive, those individuals have been isolated, should be isolated now, away from others, and contact tracing through the local health department should be following up on all of those contacts. So just, again, a good question. Thank you.
All right, thank you, Mark. Next, we'll go to David Beard with the Dominion Post.
Hi, this is David Beard with Pfizer and BioNTech seeking that emergency use authorization for the vaccine. I wanted to ask 5 little bullet points about how it might unfold here in West Virginia. 1, will it be mandatory or optional? 2, would it be free or how would it be paid for? 3, what age range would need to be vaccinated, especially thinking of kids? 4, how long would it last? Would it have to be applied or redone annually and tweaked for mutations? And then the last one is kind of what minimal population level do you need to get vaccinated for us? Population penetration level do you need to reach for us to feel comfortable taking our masks off? Thanks.
Well, everybody on our team's going to have to weigh in on that. To you guys, the one thing, David, that I would say in regard to how long it will last, we really don't have data that's going to tell us that this is going to last for 6 months or it's going to last for 3 years or it's going to last for a lifetime yet. We don't have that data because, nobody's dealt with anything like this before. I think we have the data that is going to last for months, but beyond that, we do not have the data because nobody's dealt with this thing before. But anyway, let our whole panel weigh in because they'll have a lot more information than I.
Well, I'm happy to start if you guys want me to, or okay. So thank you, David. Some of the questions you ask have not been completely delineated. And part of what we're doing now is working closely with our DHHR colleagues, our National Guard colleagues, CDC, the federal government to understand and articulate for them, how we're going to take the doses that we presume will be coming very quickly and start to prioritize the use of these this initial allocation of vaccine. And in general, I think what most people agree to is that our highest requirement is to maintain our healthcare system intact. So certainly we know that part of the prioritization in West Virginia and the country will be around healthcare and healthcare workers. We also need to maintain our vital infrastructure and make sure that we have a safe and healthy workforce for that. We know our first responders are also people who are on the front lines who contact people, back and forth. So as we articulate and understand what the initial allocation of vaccine will be for West Virginia, then we'll be working closely with all the agencies at the federal level and also with our key stakeholders here in West Virginia, including our hospital systems, to understand how we are going to allocate those first parts of the vaccine and make sure that people get it. If it comes down to requiring, mandating, that's certainly, and outside of my pay grade. But I think that one of the things that we've seen as we continue to get more vaccine doses, that for schools, having our children needing to be immunized as they go to school has really made us one of the country's best states when it comes to immunizing school-age children. But if you look at preschool-age children, we're still not very good. So certainly looking at trying to facilitate and get people the vaccine is important. The governor's right. We don't know how long the immunity will last. We do know that for the Pfizer vaccine and for the Moderna vaccine, people will need to get 2 separate vaccinations about 2 weeks apart. And there's some data to suggest that maybe the immunity will be longer than we initially thought, but that will remain to be seen. When it comes to herd immunity, when it comes to penetration of the vaccine and the immune response in the population, we still believe we'll need about 70 to 75% of the population to be immune to the virus in order to get herd immunity. And as you say, get to the point where maybe we will not have to all wear masks anymore. But I think that, as we've seen in Asia and other places, certainly, this pandemic should be a warning call for us to make sure that we are adapting our public health, foundation and also our approach so that we protect ourselves and protect each other. And these same safeguards, vaccines, masks, hand washing, et cetera, are good for influenza and other winter viruses that still kill Americans and kill people in West Virginia. So I think that although everybody's ready to already take off their masks, I think it's going to be really important for us to be extra diligent in wearing our mask as we start to roll out the initial vials of the vaccine, and then understand better how rapidly we can immunize our entire population of West Virginia and the country, but also to understand what that means and to make sure that we are still doing those really important protection measures as this is unfolding.
All right, thank you, David. Next, we'll go to Lacey Pearson with the Charleston Gazette-Mail.
Hello, thanks everybody. This is Lacey Pearson at the Gazette-Mail. I kind of wanted to touch on something that kind of goes hand in hand with Thanksgiving, which is Thanksgiving Eve, which lately and traditionally, as people are away from college or just out of school in general and they come home, a lot of people tend to go out, particularly to bars, the night before Thanksgiving. So I just kind of wanted to rehash what regulations may exist for people, for bars in particular, if people do decide that they want to go to bars, which I know that kind of goes against what you've been saying about Thanksgiving in general, to avoid large gatherings. But just wanted to touch on Thanksgiving Eve, go over regulations for public spaces like that again, just to put that information out there leading up to next week.
First of all, I hope someone can understand the question. I couldn't understand it at all, but I think I got these parts, but I don't know. I'd let somebody else answer it because I couldn't. I don't think I could understand it at all.
I'm happy, Governor, that you want to go, Bill?
No, go right ahead, Clay.
So Governor, I believe the question was about perhaps people going to bars on the Wednesday before Thanksgiving, and what guidance would we have? And of course, our guidance would be don't go. And if you need to go, then go and sit only with people that you live with all the time. And if you're going to go, leave your mask on at all possible times. And if you take a drink and put your mask back on. But right now is really the time that we don't want people to go into indoor environments where they're going to take their masks off and where they may be in a point where they're not able to, manage that really effective strategy to protect themselves as well because of the impact of alcohol. So this would be a year that if that's a tradition for you, maybe this is a year to create a different and new tradition, staying at home and being with your family. That would be the safest way to handle that, I believe.
All right, thank you, Lacey.
On that now that I've got the question and everything, first of all, we've not put any further restrictions on the bars, and to tell it like it is, real and true, I think we should, halfway commend our bars because we really don't have anything that we can, that's come up that we're able to track, situations back to our college bars. And, the people in WVU, we did, close our bars there for a while, but evidently they've got to be doing a lot better. We actually recommend always to all the kids and everything, please keep up. You must be doing pretty good work. Keep up what you're doing, and protect yourself and your neighbor and everything there, and wear your face coverings, and bar owners and everything. Please, enforce that. And I think we're doing halfway decent there.
All right, thank you. Lacey, next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Dave Mistich, West Virginia Public Broadcasting. My question, I guess, is sort of similar to Lacey's in some way, maybe a little different, though. I'm curious, we're seeing, governors from other states, offer some curfews, different things, not necessarily full-on shutdowns or closures, but sort of limiting the time that businesses can be open, particularly into the night. I guess my question is that on the table, especially given, as you say, that a shutdown is not, but yet the numbers continue to spike?
Hey, I've said over and over, and I want to make sure everyone totally understands. As of where we have been, I said there is no possible way at that point in time that we need to shut down anything. Have I not just said exactly that? I've also said everything's got to stay on the table. You see what's going on across this nation? I mean, for crying out loud, there's people that are shutting down all kinds of different things. And if this situation continues to get worse, we're going to have no choice also. We have got to be able to protect our people. And absolutely, we're not going to just sit idly by and for whatever the reason, decide, well, nothing can ever be shut down. Well, in this situation, it should never be said. Nothing should never be said. Because in this situation, all we're trying to do is keep our people safe and keep our state open and keep our people employed. Everybody here is trying to balance exactly that. And at the end of the day, nothing everything should be on the board. We should not be saying never. We should not be saying nothing. We should be praying that it gets over, but at the same time, I'm trying within all in me to keep everything open and to not change hours and to not restrict anymore. For crying out loud, I have asked so little, it is unbelievable. And we had a bunch of people that decided that I was infringing upon their liberties or their constitutional rights, or the next thing is going to be their guns or whatever it may be. That is so silly, it's off the chart. What I am telling people is just this. Today, we do not need to shut anything down, but today, things are getting worse by the minute, and absolutely everything is on the table. And as we move forward, it may very well be that I have to come back in here on Monday and we have to take a pinpoint, a scalpel to situations instead of a sledgehammer. We've got to go into certain counties and do things that are more radical or more modifications than what we've already done. Without any question, if anybody thinks that things should be set in stone, that we're going to stay open no matter what, we're going to close no matter what, absolutely it's the wrong way to think. Everything ought to be on the table, and absolutely all of us are trying to work towards not shutting anything down, but at the same time, we've got to know that everything should be on the table, and it is.
Okay, thank you, Dave. Next to Brendan Tierney with WSAZ.
Thank you. Good afternoon. Brendan Tierney with WSAZ News Channel 3 here. I have a question for the governor as well as Dr. Marsh, because yesterday the CDC and the White House Coronavirus Task Force came out saying that they've never recommended closing schools. And even today, Governor, you repeated that schools are the safest place in West Virginia for schools. So why are schools closing in West Virginia?
You know, our map is working. I know it's frustrating. I know that our Department of Education knows more about education in their little finger than I know. I know our county superintendents are doing a good job. Unfortunately, just to tell it straight up like it is, Brendan, is just this, is, you know, our teacher unions and union bosses tried to pressure the state. Then they tried to sue. On both levels, you know, they were, you know, rejected. So what they've done is, just to tell it like it is, they've gone to the counties and they're pressuring counties to make moves and everything. And if you don't watch out, you know, that's really not what we should be doing. We should absolutely be listening to the experts. We should absolutely be listening in every way to what our experts are telling us. Without any question, we all know that our kids need to be in school. They desperately need to be in school. And without any question, you know, as things go, if our colors in our color map gets terrible bad, you know, we do shut down. If we go to red, we do go to 100% virtual. We have these fail safes already built into the map and everything. And now what we're doing is we've got pressure from the unions, and then what we've got counties that are reacting, and we're probably not reacting exactly how we should with the advice of all the medical team.
Okay, last question today is from Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. The COSAP grant announced back on the 10th, I believe it was. Among other things, the funds made available through that were going towards school prevention, to expand the PRO program into some other counties. In the event that schools were to transition to a virtual learning situation for the remainder of the year, I know that's hypothetical, so I guess this is kind of a bit of a what-if question. But if that were to happen, does that, or would that raise any concerns about delaying that expansion? Is it in any way possible that the grant could be rescinded if the funds weren't used for that purpose within any specific period of time? Thank you.
Matthew, you know, I don't know how to answer it other than to just say that I don't think that the grant's going to be rescinded in any way. It is just, I guess there's anything that's possible. Right now, I don't think we need to have concerns over the points that you bring up. You know, it's just something that I would say, you know, it's valid points and good thoughts, but you know, at this point in time, I think we're fine with that. I do not think the federal government will rescind. In fact, I really believe, Matthew, just this: if things get worse, and they're worse in West Virginia, they're going to be really bad probably in Ohio, in Pennsylvania, in Maryland, in Virginia, in Kentucky, Florida, all across our nation and everything. And if they're that level of bad, the federal government's not going to be rescinding. They're going to be sending. They're going to be doing everything they possibly can to help. And they're absolutely not going to be retracting anything. You know, at that point in time, you know, let's just hope and pray we don't get to that point in time.
All right, Governor Justice, back to you.
Well, I try to make notes as best I possibly can. You know, I want to read to you that we put up today a new map, and that is our free testing map announcement. And today I am happy to announce, and you can see it on the website right now, that we have launched a map of all the free testing locations in West Virginia. And this map is located on our COVID website. It will provide real-time access to all available testing sites. And I encourage all West Virginians to use this resource to find a location for yourself or your loved ones to be able to get tested. So, you know, if you'll just follow and check that map and everything, that may be able to help you some there. I want to talk just a second back about Berkeley County. Again, I want all those that are on those great football teams to know that, you know, I've been a coach forever, and I know exactly the commitment that you great athletes and coaches are making to this sport. I know how important that sports are to the fabric of all of us. You know, the only thing I would say again to you is just this. Today we have a situation that is really tough and really bad. You know, from the standpoint of how decisions are made on where we test, well, that's way off my pay grade. I don't make those decisions on where we test. I listen to absolute superintendents that are calling in and principals and everything, and we try to help everywhere we possibly can. We try to supply resources and run to the fire and help you every way we possibly can. Keep calling us. Keep giving us information and everything. But as far as me selecting, say, more sites in Kanawha County than Berkeley County, that's hogwash. You know, at the end of the day, I want you to know that we're trying with all in us to be able to help you, to be able to go to school, to be able to play ball. We recognize the importance, but at the same time, something has to take back seats right now. And really and truly, as much as I love sports, it surely needs to take a back seat to going to school, and it absolutely needs to take a major back seat to the fact that we've got people dying. You know, before I go, I want to thank again WQBE Radio, Jeff and Junior. It was great. You know, I appreciate Dan down at Spring Hill Rod and Gun Club or Rod and Gun Store. And, you know, I was there not long ago. We did an announcement there in regard to the NRA, and I ended up buying 2 shotguns. They're good salesmen. And I promise you I'll be grouse hunting and quail hunting with them soon. So like I said, I really enjoyed that this morning. It was great. You know, the only other thing I would say is just this, is no matter what anyone says, no matter what a politician says, or no matter what anyone says, I'm going to do one thing, and you can put this in the bank. I'm going to do all I possibly can, irregardless of parties, whether it be Republicans, Democrats, Independents, whatever. I'm going to represent the people, and I'm going to try to look after every single one of you. I am going to listen to our medical experts. I am going to listen to our education experts, our National Guard experts. I'm going to listen to the federal government. I'm going to listen to our president. I'm going to listen to hospitals all over the land. Absolutely. And just ask yourself one question. One question. You know, do we want to listen to our politicians, or do we want to listen in this time of need to our medical experts? You know, if you think that our politicians who want to be just politicians, do you think for a minute that they have the information and the insight that our medical experts have? You know, growing up, when I had somebody sick in our family, we always went to the doctors. If you've got sickness, and that's what we have here, we go to the doctors. We go to the doctors, and they absolutely give us the best advice that they can give us. And we should listen to our experts. You know, I want you to know that I am here to be your governor. and I'll do my job. Again, I thank you a bunch, and I hope and pray in every way that you won't forget these 639 people that we've lost in West Virginia, and I'll see you Monday. Be safe in the woods. Thank y'all.